Spokane Regional Health District talking, and thank you all for joining us for today's Lunch and Learn session. We're actually going to go over today some more presentations about reporting your monthly inventory and doses administered in the Immunization Information System. So first, a couple of things. Can everybody hear me okay?
Yes.
Okay, perfect. So just as a couple of housekeeping items, please be sure to mute your phones to avoid any background noise during the presentation, and try not to put us on hold because then we'll hear your hold music. And you can definitely type in any questions you have into the chat box, and we'll talk about those together as we get them. And then we'll also have a question and answer session at the end of the presentation. We're also recording this so that you can access it later as well. And today we have JC Fitzpatrick, who's going to talk with us today. She works with Scientific Technology Corporation, and she's a training specialist with them. And they are the vendor for the Washington Immunization Information System, and also contracted with the State of Washington Department of Health. So we're going to review a couple of things with us today. She's going to go over first how to submit your monthly reports if you have an interface with the IIS and you use an electronic health record. And she's also going to do a brief presentation as well about submitting what we call aggregate data if you don't have an interface yet with your EHR. Okay? So first, can we get an idea of who is on the call, just so we can take kind of a roll call? So I'm just going to go down our list. Brenda Barney, can you just let us know what clinic you're with and if there's anyone else listening with you? Are you there, Brenda? Okay, we'll move on. Bev?
Hi, I'm here. I'm from Jazz Clinic.
And is anyone listening with you?
Nope, I'm on my own at the clinic today.
Okay, thanks for joining us. Carlene?
Yeah, I'm here, and I'm from Associated Family Physicians, and I'm by myself.
Great. How about Julie?
Yeah, Julie from Providence Family Medicine Residency.
Great, thank you for joining. Karen? Are you there, Karen? She might not have audio. Yelena, can you hear us? How about Mark? And Patty?
Danette, I'm here.
Hi, thanks. And the Kids Clinic. Who's joining us from the Kids Clinic? Okay, they might not have audio either. So now that we have an idea of who's on the phone, we can go ahead and she can tell us about online reporting.
All right, thanks, Danette.
You have the controls now.
Okay, perfect. Let me just see. Okay, can you see my screen?
Yep.
Okay, so I'll pull, I don't see the PowerPoint, so I'm going to just pull up mine, unless I don't know how to pull yours up. I'm sorry.
Let me get back. So can you see
Okay,
the PowerPoint when I shared the controls with you?
I just put mine up, so hopefully everyone can see it's the same PowerPoint. So,
okay.
All right, so as Jeanette mentioned, my name is JC, and I work with Scientific Technology Corporation. And today we're going to talk about online inventory reporting. And we're going to cover two different types of users. So those who manage their inventory in the IIS with an EMR or an EHR that has an interface. And then also we'll cover how those providers who don't manage their inventory in the IIS, so either they're the aggregate reporters or their interface isn't working correctly. So I'll make sure to differentiate the slides where there's differences for the different types of reporters. And please feel free at any time during the presentation to ask questions. I'm not sure if you'll be muted, but if so just type them in the question or the chat box, and we'll make sure to get to everybody's questions. So with that, I will just get started. So this slide is just talking about our workflow. It's kind of nice to be able to see this with the different colors that differentiate the different workflows that we need to follow. So the first one you see is troubleshooting. Hopefully everyone is using some sort of troubleshooting technique in their office in case their counts are ever off or they have less or more doses and they need to kind of figure out where those offages are coming from. We'll talk about doing counts. So that's actually going physically to your cold storage and doing inventory counts. And that's also where the troubleshooting comes in. So if you see numbers are off, you can make those adjustments as needed. Next with the workflow, after we do our counts, we're going to do our doses administered report. And then after we've submitted that, we'll move on to our inventory submission. So that's in your reconciliation page, which stores all of your inventory that the IIS thinks you have at your clinic. And then last but not least, I'll show you where you can find dates to make sure that your reports have been submitted successfully. And then if you needed to order, you can kind of go from there. So that's kind of the workflow that we'll be talking about today. All right, so starting our report. So doing a cleanup is the very most important step to this whole process. So if you haven't been reporting online, you definitely want to make sure you're starting with a nice, fresh, clean inventory set. So there's 3 steps to doing your cleanup, and the first step is to prepare. So what that means is to have all your counts ready. So going to your cold storage, to your refrigerator and your freezer, and doing a count. So looking at every single box and lot number and vial of whatever vaccine and doing your count. The second step to that is doing a cleanup. So that's actually going into the IIS, putting your numbers in for your physical inventory, and inactivating lots that you either no longer have, reconciling using your troubleshooting techniques, and also you can add vaccines at this time if you have lots in your refrigerator or your freezer that aren't in your reconciliation page. And then the last step to your cleanup is making sure that everyone on the call knows that you have to receive your order in the IIS every time you get an inbound order into your office, because the system is not smart enough to know that if you get an order and you put it in your fridge, it's not going to know that it's in your inventory and ready to be selected when given to patients. So receiving and making sure you know how to do that is very important, and we'll cover all this today. All right, so what you see here on my screen, this is called your reconciliation sheet. And how you get to this page in the IIS is first by logging in. Everyone's organization and facility should already be pre-selected. You'll want to come over to this left-hand menu and click on lot number. And then you want to click on reconciliation. What this shows is all the inventory that you have currently in your clinic. So you'll see all the different vaccine names, all the lot numbers, expiration dates, and then this column right here, the quantity on hand, is what the IIS thinks that you have at any given time in your cold storage. So this is the number of doses of vaccine. You'll notice here that this column is blank because this is where you're actually going to type in your counts after you've taken this worksheet to your cold storage and done that initial count. And you'll see here we have this nifty little print button. What that does is prints off a page that's blank here. It will leave this column blank, and it will have all this information here, the first 4 columns, auto-filled in there so that you can actually just write down with a pen or a pencil and come back into the system and then type in your physical numbers. All right, so back to that third step of our cleanup, talking about receiving. So you want to make sure before you start any of your counts or your monthly reporting that you come in here and you make sure that you don't have any pending orders that need to be received that you actually got into your clinic. So you'll notice over here underneath status, if you ever see anything with an approved status, you know that it's either on its way to your office, this order that you submitted, or the order is already there and it's waiting for you to come in and tell the system that you received it. So the first step to receiving your order is by getting into the Create View Orders page from your left-hand menu in the IIS. You'll select whatever order you just received. You'll notice here this bottom picture. This is showing an example of receiving an order with of MMR, and you ordered 20 doses. So after you look at your MMR and everything looks great, there's no broken or cracked vials in there, so everything's usable. The last step is just typing in the amount that you received, so 20 in this example, and then you just want to click Receive. Once you click Receive, you'll notice that this line will disappear, and all that inventory, that 20 doses of MMR, is going to be in your reconciliation page and able for you to select when giving to patients. So I'm just going to pause actually after this step to see if anybody has any questions about receiving your order or how to get to your reconciliation page. All right, great. So if there's no questions on that, we'll just continue. All right, so now we're on to our next workflow step, so our count. So after you've printed off your page, your reconciliation worksheet, and you've done your counts, and you just want to go ahead and set that off to the side, and I want you to focus right here on this highlighted colored block. So what this shows is a snapshot kind of what's in your fridge and what's happening. So you go into your reconciliation worksheet and you notice that you have any colored rows or columns. You want to look down here at this box and it will tell you exactly what those colors mean. So anything that's going to be highlighted in yellow is going to be a vaccine that's going to be expiring in 30 days or less. If you have any columns or rows highlighted in red, you'll know that that's actually expired vaccine and you need to get that out of your refrigerator or your freezer, fill out the proper paperwork, and get that sent off to your LHJ or your local health jurisdiction, in this case the Spokane Regional Health District. So this is kind of just a helpful tool to make sure that you're not wasting vaccines and making sure you're using lots that are going to be expiring sooner than other lots of the same vaccine. All right, and this is, oh, do we have a question? Okay. This is an example of that reconciliation worksheet once it's printed off, and you'll notice here that all these 4 columns, the first 4 are going to be filled in, and then here's where you write down your physical inventory. And you won't have to worry about any of these columns over here because the IIS is smart enough to make those adjustments if you have less or more doses than your quantity at hand is showing. So that's just what this worksheet will look like when you print it off. All right, so once you've done your count, you'll just want to go ahead and set that worksheet off to the side, and we'll start with our very first report, so our vaccine administered report. All right, so what this report is useful for is to account for the doses of vaccine that are used from your inventory that were administered to patients. So how you'll get here is by clicking on lot numbers again on that left-hand menu, and you'll click on the very first drop-down, which is called the dose administered or the vaccine administered report. So it's important to notice that the different colors here on the screen mean different things. So anything highlighted in red is a required field, and you do have to enter in something for every single box. So you'll start off by just simply putting your name, your phone number, and your email address. And what that is for is in case that Danette or Alexandra have questions on your vaccine administered report, they can quickly contact you by just pulling up this information. Then the next red highlighted box is going to be your vaccination date range. So that's going to be the date range of which you're submitting your reports for. So if we have callers on the phone today that just report from the beginning to the end of the month, you'll just type in, this is an example of June 1st through June 30th, so beginning and end of the month. And then for your reporting month, you'll want to select June. If we have any mid-month reporters on the phone, and let's say, for example, you report from the middle of the month, so let's say June 15th, and then you go all the way through July 16th. Sometimes it's confusing as to which month to choose because you're submitting some from June and some from July. But just make sure that you know that for the reporting month, you always want to select the month in which your reporting period begins. So you'd select June if you were submitting from June 15th to July 16th. And then your organization and your facility will already be filled in for you. And another thing to remember, too, is that the IIS is not going to let you overlap or recreate or submit reports that you've already submitted. So if you receive an error when you're creating your report because it says you've already submitted for a certain date, you just need to make sure, again, that you did not accidentally put last month's information in, and you want to fix those dates and then come back down to create your report, and then it will work for you. All right, so I'm just going to pause here and make sure that everyone on the line knows that this slide right here is going to be specifically tailored to those that have an interface, so their EMR or their EHR talks to the IIS and sends information back and forth, or just to the IIS, I guess I should say, and they don't have to actually come in here and enter in stuff into patient records. So for those interface users, I will say that also yours will look a little bit different than mine because this is just a test created report, but yours will have numbers here. And you'll see here that you have on the left side all the different vaccines, all the lot numbers, and then along the top it's going to be categorized by age range. So this is when it's important to take that reconciliation worksheet that you did your physical count with and kind of look and make sure your numbers are adding up. And if anything looks off, or if you notice here that you maybe gave some publicly supplied child vaccines to maybe someone over the age of 19, this is where you'll want to make sure to do all your troubleshooting before you submit this report. Because again, once you've submitted your report, you can't go back and resubmit it. So if you need to go back and you need to go to your EMR or your EHR and do any of that troubleshooting in patient records, you can always save it just by clicking save, and then fixing your or using those troubleshooting things in your EMR, and then you'll want to come back, and then you can go ahead and submit once everything looks okay.
Danette, I have a question. This is Beverly from Chaz.
Hi, Bev.
Hi, or I'm sorry, I was talking to, that was JC, sorry. I got confused.
That's okay, I'm listening.
Okay, and so we're just starting again to have our interface work again, and as far as I'm still trying to figure out, it's supposedly been working okay. But the last couple months, I've submitted this report, and the numbers have not been correct because of the interface issue. And then I have some of my staff that are going in and editing, and it's really impossible with our information to edit because we don't break our lot numbers down by age group. Is it okay that I'm doing it that way and just submitting the report however it turns out and going from there? Because I'm hoping as we get going that I can check it once I know my interface is working every day all the time, then I can go back and check and make sure this is doing it correctly. But until I know my interface is working, it's really difficult to do this editing.
So are you saying that you have this edit function when you're going in and you're creating your vaccine administered report?
I don't do it. I haven't been doing it myself, but I have 6 other clinics, and one of them was telling me that they couldn't send this report. They didn't know how because the numbers weren't right, and they were trying to hit edit and go in there and say, I gave this lot number to this many 2-year-olds, and it it doesn't break down like that when in the reconciliation. Yes, it does. Not to age group.
Okay. Okay.
I can help answer this question. This is Danae.
Thank you.
And I was actually working at one of your clinics yesterday, training one of your new coordinators. And until you have final confirmation that your interface is working, and again, you can talk to JC probably after this training about that too. She may have information for you, or again, those other contacts we talked about earlier, just to get that okay that you are good to go and everything is working with your interface. However, when you're tracking those doses given by age range every single month, you do want to be doing that by lot level. So you want to be able to say, we gave this many doses of lot blah, blah, blah of DTaP to 4-year-olds, for example. So there's some different tools. I worked with your one clinic yesterday to do that. So you may want to spread that through all of your clinics, so that your coordinators are your vaccinators are capturing lot level data, so that your coordinators know what to report each month.
Because we haven't been. So so what clinic was that you're at, and I'll ask her for those tools.
I was at Denny Murphy, and I'm happy to share some other.
Oh, you were here with Kelly. I'm at Denny Murphy today. Okay.
Oh, okay. Yeah, I was there yesterday with Kelly. So there's different ways you can do it as far as tracking the lot level data, so you know what to report. And then again, when you're submitting your monthly reports in the registry, because you may or may not have your interface working 100%, you may be able to do like an interim process where you can edit it if needed until you are 100% with that interface. So it's kind of, you're a little bit in limbo, but there's still ways to report that information, and I can help you with that too.
Thank you. Okay, thanks.
Okay, great. Yeah, then what she said was perfect. So, yeah, if you have other questions, let's talk after this training a little bit more. If you need to contact the help desk, I can get you in touch with them. So,
thank you.
Great questions. Does anybody else have any questions before we move on?
This is Danette again. Sorry. I just wanted to add one more thing. So this vaccine administered report, you have on there, or we have on here this presentation that it's for interface users, and this is what it would look like. But we also have some clinics logged in right now that actually manually enter that data into the registry. So you really have patient-level data in the system, and your report also would look like this, which you're familiar with. If you're entering patient data manually into the registry, it would also look like this.
Perfect. Thank you. All right. So then this next slide is for those aggregate users. So like Jeanette was just saying, people that come into the IIS and manually put their information in here. Or let's say your interface right now is not working properly and your numbers are off. So in that case, if you are that kind of user, you should notice that on your vaccine administered report, you'll have this edit button here next to the save. And once you click edit, it's going to make these boxes that are currently 0 and not able to be filled in, it's going to make them fillable so that you can take whatever documentation you've been using in your clinic throughout the month. So it could be like a hash mark report or just some sort of report that you're keeping track of every vaccine that you're given and giving to patients for the different age ranges. So once you click on the edit button, again, it will make these boxes fillable, and you can go in and enter your information right into these boxes. So it works the same way as the one before for our interface users. So this is the time where if you have any troubleshooting techniques that you need to take care of and go back and fix anything in your EMR, EHR, you can do that by clicking save and not submit. So if you need to stop or pause or you get pulled away, you can always press save. And then the very last step, once you've filled in all your information in the different boxes, is just by coming down here and clicking submit. And then that report will be sent off to your LHJ, and you will be finished with that vaccine administered report. So are there any questions before we move on to our second report? Okay, great. So the second one we're going to work on is going to be our monthly inventory. So this is going to be the report where after we used our reconciliation worksheet and took it to our cold storage, this is when we're going to come back into the IIS and actually start typing in that physical inventory here in this column. So again, how you get to your reconciliation page is by clicking on lot number, on reconciliation. So I also want to talk about some examples of how to choose the best category and reason if your physical inventory numbers are not matching your quantity on hand. So we're just going to go over a couple examples in the next few slides. So up here, this is an example of after I took my reconciliation worksheet to my cold storage, I noticed that I have 0 doses here of my DT. And then in the system too, it's showing that I have 0 in my quantity on hand. So it's a good habit to make sure that you're inactivating lot numbers with a 0 value to keep your inventory fresh and clean and tidy. So how you do that is you have to type a 0 into your physical inventory box. It won't make you choose a category and a reason. And the last step to getting that inactivated is just clicking here in the inactive box. And then what happens after that is if you save your report or you submit it when you're completely finished, the next time you come back into your reconciliation sheet, you won't see this row anymore. You just want to make sure that you're always inactivating anything that has a 0 value to it that you don't any longer have in your cold storage. So our next example is after we did our count, and it's always a good practice too, if your numbers are off, to do another count. I know it takes a little bit of time, but we want to make sure that you're accurately entering what you have in your cold storage into the IIS. So let's say after you did your counts again, you noticed that you only had 99 doses of your DTaP, when really the system was showing that you should have 100 doses. So hopefully in your clinic you have some sort of tracking system as well that's keeping record of anything that happens during the month to vaccine. So let's say, for example, you received your vaccine in your clinic and you are transporting it from the box, or somehow when it was getting moved to the fridge, one of the doses was dropped. So, and you have that written down on your documentation from the first of the month. So let's say it's now the end of the month and you're doing your counts. You want to make sure that you put 99 in your physical inventory if that's all you have in your refrigerator. You'll notice that the adjustment column will adjust it to a -1, showing 1 less dose. And you'll just want to choose the most appropriate category and reason. So for this example, we choose wasted, and our reason would be broken, dropped, or spilled. All right, so this next slide talks about, again, having less physical inventory than the quantity on hand is showing. But let's say after you went back and you looked at your documentation, you don't have any record of having less doses of your DTaP. There was, no broken or dropped or spilled or spoiled vaccines throughout the month, and you just need to account for that still. So there is a best category and reason to choose. In this case, especially when you're doing your initial cleanup, you're going to probably run into a lot of these instances and you're not going to know which category to choose. So if you, again, don't know what happened to that, the best category to choose would be administered, and your reason would be administered but not linked to a vaccine. All right, so after doing your counts, and let's say that hopefully this is our end goal, is that your quantity on hand matches exactly what your physical inventory in your cold storage is showing. So if that's the case and you have the same amount, so this is showing here 60 doses is what the IIS showed that you have, and then your physical inventory too is 60. It won't make you choose a category and reason for that, so you won't have to worry about it. So let's say that after doing your counts for your IPV, you realize that you actually had more doses in your physical inventory than the quantity on hand showed. So you, again, do your counts again, make sure that you didn't just make any human errors. And then let's say you looked at your documentation, there was no transfers throughout the month that came to your clinic, and you just really don't know why you have an extra dose in your fridge. So the best category and reason to choose for that is going to be order received, and then your reason is going to be received from the VFC program. And I'm not sure if the next slide shows it. No. So there is also a choice to, let's say you need to account for, let's go back a slide, that's 2 slides. Let's say you need to account for a certain vaccine and there was multiple reasons why you have less. So there is a column over here that's called add a row. What that does is it creates a brand new row here underneath whatever vaccine you need to account for, and it will pull down the name, the lot number, and the expiration date, and it will allow you to choose a different category and reason choice if there's 2 different examples or 2 different situations throughout the month where, let's say, one was wasted and then one was drawn up but not given to a patient at the last minute. So the system does let you add rows so that you can accurately tell the system what is going on throughout the month in your clinic. All right, so let's say that we went down and we entered in numbers for every single vaccine that we have in our stock. You'll notice here that for anything that had a 0, we came over and inactivated it. And for anything that we had more or less doses of, we chose a correct category and reason. I will encourage you, for anybody on the phone today that has lots and lots of inventory, that periodically when you're coming in and you're doing your counts that you're saving. So I would encourage maybe every 5 to 7 enters that you do in the system, you want to click save. That will prevent, if you receive any errors, then you can go and quickly change that and make the proper edits, and you won't lose everything that you've already worked on for entering. So it just might save a little bit of time in the long run if you just save. And make sure you remember where you stopped at, because the system's going to make those adjustments and it will kind of look a little bit confusing. So make sure that you save and you remember what vaccine you left off on counting. So once you've gone through and you've made all your enters, the last step to submitting that is by coming down here at the bottom and clicking on Submit Monthly Inventory. And then that report, too, will be sent off to your LHJ, and you'll be completed with both of your vaccine administered and then your monthly inventory. And I do encourage clinics, and you need to be doing your counts at the same day you're doing your reports. So I would encourage doing it at a time in your clinic when you won't have people in and out of your fridge, so your vaccinators pulling lots to give the patient. So either doing it early in the morning before you open, or doing it late in the afternoon when a low volume of people will be in and out of your fridge. So it's important to not do your counts on Monday and then come into the system and submit your reports Friday, because that's not going to be accurately describing what you physically and currently have in your cold storage. So let's see what the next. All right, so if you're not doing this already, there is a step that you can come in and take to make sure that both of your reports were sent and received successfully. And you'll do that by checking the dates on which you submitted your report. So after you've submitted both, you'll want to come back into the system and click on Orders and Transfers. And you'll want to click on Create View Orders. And down here, you'll click on Create Order. And this, again, is the same page where we talked about receiving earlier in the presentation as well. So after you click on the Create Order, you'll notice here that this red circled box is going to be showing the last inventory date submitted for your monthly report and your vaccine administered report. So you'll want to make sure that these dates match the date that you submitted. And if both dates are correct, then you know that your reports were sent successfully. Let's say that one of them was the same date and then the other one was from the previous month. So then you'll know that there was probably an error when you submitted that report. Let's say, for example, you unaccidentally just pressed Save instead of Submit. You can go back to that report and submit it, come back to this page, make sure your date matches, and you'll know that it was sent successfully. So that's just a good habit to get in, just double checking your work and making sure that everything was sent off properly. So do we have any questions before we move on from anybody on the call? All right, perfect. All right, so once everyone is doing their reports online, and again, once you start reporting online, do note that you can't go back to the paper way. So once you make sure that your clinic is in a good spot, you've done a really good initial cleanup in your inventory, and then once you start submitting online, you'll continue doing it that way throughout every month from here on out. And then it's also important to note that once you start submitting online, you don't need to send in your paper reports to your LHJ any longer. So the only reports that you'll need to continue or papers or forms that you need to send in to Danette is going to be your temp log, any incident report, and your transfer form. So those are the only thing once you start submitting online that you need to still send in by paper or fax, email, however you guys are doing it in your clinic. And again, once your clinic is ready to do this online reporting, you can begin at any time. So don't think that you have to wait until the end of the year. You can start next month or this month or whenever you're doing your next reporting. So with that, let's see. We can talk about some best practices, but do we have any questions on either of the reports that we talked about? Okay, then we'll move on to our best practices. So it's important, again, that third step to our cleanup was making sure that you're receiving your inventory within the IIS when your vaccines are delivered to your clinic. So just get in a good habit. Whenever you receive a box, go into the system, make sure that everything looks good in your box, and tell the system how many doses you received. So then it will take that order and put it right into your reconciliation so that vaccinators can start choosing the proper lot numbers. Also making sure and practicing good fridge management throughout the month. So using those lots that are going to be highlighted in yellow if you have any, which is going to mean that they're going to be lots that are expiring in 30 days or less. Also, if you have multiple lots of the same vaccine, only having one open at a time, that will lead to less room for error. And again, when possible, completing all your steps and counting and submitting your reports at the same time. So either doing it early in the morning when you have a really low volume of vaccinators in your clinic, or doing it in the afternoon is when we found the best and ideal times for doing your counts are. Making sure and keeping track of your used doses, so develop a system within your clinic if you don't already have one, or maybe modifying it if today you learned a couple new tips that might help your clinic out, and logging any wasted, spoiled doses right when it happens, so then at the end of the month you don't have to dig through your brain and remember what happened on the 2nd of June if it's June 30th and you're doing your report. So, and then also knowing that you can contact Danette if you need to talk about any wastage in your clinic. Always choosing the best category and reason to account for your vaccine. So again, if you have less or more doses in your reconciliation, so when you did your physical count, then what your quantity on hand is showing, choosing the best category and reason for that. Always double checking your work after you've submitted your reports and going to the create order screen and making sure that the date that you submitted your inventory are the dates that the report is showing. And then also knowing that there's going to be training materials posted in the IIS very shortly and also on the DOH website. If you have questions about online reporting, or you just need a little bit more clarification, or you think it might be helpful to print off some quick reference guides or some information forms that will help you through this process. And also knowing that you can contact Danette or Alexandra at any time if you have questions, and that the help desk is always there for you too if you have technical questions about your interface or how to report or what kind of reporter you are, those types of things. And I'll leave this slide up for a few minutes here. This has the help desk's number, email address, and the phone numbers that hopefully you have written down. And if you don't, make sure to jot them down right now. All right, Danette, so that concludes my presentation. So do you want to just open the floor up for questions?
Yeah, thank you for going through all of that for us. Does anybody have any questions before we sign off? And you can feel free to chat, put them in the chat box as well, and we'll go over them together if you have any.
Danette, this is Beverly again. I don't have any more questions. I appreciate the training material today. I'm glad you were able to come meet with Kelly yesterday as well. And I'll see you at the meeting on the 14th. Or the 12th,
great.
Whatever day that was. Okay.
Well, thank you.
Bye-bye.
Any other questions out there? Okay, I just want to remind everybody that we will be posting these to our website because we've been recording the training session. So if you want to share it with other staff that maybe couldn't attend today or other clinics as part of your organization, they will be able to access it on the Vaccine for Children program webpage through srhd.org. And then with that, I think we'll leave you if there's no other questions. And thanks again for joining us.
Thank you. Thank you, everyone.